Yes, I would like to share with you today about the disease malaria, and basically, we shall look at what malaria is, what are the symptoms, what are the causes. We shall get to know the complications, the treatment, and the prevention, and things of the like. So, to start with, malaria is, first of all, is one of the major public health problems that we have in the country today. For that is the truth. Yeah, that is very true. And it is caused by a protozoa, to be more specific, Plasmodium. So, when we talk about the types of malaria, you realize that parasites of the genus Plasmodium cause malaria. There are very many species of Plasmodium, but there are only five that do infect human beings, and they do cause malaria. Just to mention a little bit of these, we have the Plasmodium falciparum, Plasmodium vivax, Plasmodium ovale, Plasmodium malariae, and Plasmodium knowlesi. But basically, of all these, we put much more focus on P. falciparum because this one is found in tropical and subtropical areas, and it is well known that this is the major contributor to deaths from severe malaria. So we put much more focus on that. For PVVAX is found in Asia and Latin America. It has a dormant stage that can cause relapses. When you go to P oval is found in Africa and the Pacific Islands. P malaria, of course, P means Plasmodium. Okay. P malaria is worldwide and it can cause a chronic infection. P knowlesi is found throughout Southeast Asia and it can rapidly progress for an um, it can be progressive. Yes, I mean it can progress from an uncomplicated case to a severe malaria infection. But like I told you, basically we focus more on Plasmodium falciparum, P falciparum, because that is the commonest here. You get it? All right. So let's continue. And of course, there are symptoms that can signify this disease of malaria. And well, I have not gone through the life cycle of the parasite, and that will be another time. That will be a special case to handle some other time. Let's get to go to the symptoms of malaria, the disease itself. So, malaria infection is generally characterized by recurrent attacks with these signs that I'm going to be speaking about, the signs and symptoms. I'll just give a mention of them. Probably if you've got a malaria at one point in time, you've experienced some of these. So the symptoms include headache. There is fever, shivering, joint pain, vomiting, hemolytic anemia, jaundice, hemoglobin in the urine, retinal damage, convulsions, coma, bloody stools, abdominal pain, shaking chills that can range from moderate to severe, high fever, profuse sweating. So, uh, and very many others. So, those are all signs and symptoms of malaria. I hope you are following very well. Sometimes they can ask you for those signs and symptoms, and it's very important to know them even in the diagnosis. They can be of great help when you are to diagnose rightly. So when you go to the complications, yes, the malaria disease has got complications, several of them, and malaria, of course, is a serious illness and it can be fatal if not diagnosed and treated quickly. So you have to be so quick at responding to the disease of malaria once you get it. You see, uh, pregnant women. and the babies, the young children and the elder, they are particularly at risk. Yes, there's a very high risk in those categories of people. I mean the babies, the pregnant women, the elderly people, and the young children. Those people, those are risk factors already, and they are at a very high risk. Uh, of the P-falciparum parasite causes the most severe malaria, and it causes those most severe symptoms and most deaths. Like I told you earlier, it is very serious. Plasmodium falciparum. As complications of severe malaria can occur within hours or days of the first symptoms, it's important to seek urgent medical help as soon as possible. So you have to take the disease serious. Seek medical help as soon as possible. This is very urgent. And other complications that can arise as a result of severe malaria, I'm going to give you a list. We have complications like liver failure and jaundice. So in this case, that's when we see the yellowing of the skin and whites of the eyes. Yes, that is about liver failure and jaundice. And then the other complication is shock. Under shock, we see and we notice a sudden drop in blood pressure. When we are taking the vitals, of course, we blood pressure is one of the important the vitals, of course, the body vitals that we take. I'll personally bring a monitor and check the patient and check all the vitals. Of course, we can't miss the blood pressure. And once we see a sudden drop in the blood pressure, we get to sense something like that. So, and the other complication of malaria is it's pulmonary edema. What do I mean here? I mean, when I talk about pulmonary edema, I mean there is a buildup of fluid in the lungs. So, uh, once we notice a buildup of fluid in the lungs, uh, that can be a complication of the disease malaria. So we call that pulmonary edema. The other complication is acute respiratory distress syndrome, ARDS. ARDS. That is a complication. Acute respiratory distress syndrome. Then the other complication is um hypoglycemia. And what do I mean by hypoglycemia? For that, I mean abnormally low blood sugar. So, malaria can cause that. Your blood sugar can get very low in times of or when the malaria disease gets so serious. And then the other complication, I want to be a little bit fast because of time. So the other complication is kidney failure. Yes, kidney failure is a complication, and the other complication is swelling and rupturing of the spleen. Yeah, so we cannot. Uh, the spleen can swell, it can rupture, so that is a complication. The other complication is dehydration. We can notice that a patient is dehydrated uh, when the malaria gets so severe and very serious. So now there are very many very many other complications. You can go do further research, but I want to run so fast now and go to the diagnosis and how do you really diagnose that and test for malaria. So briefly, let me go through that. And uh, of course, blood tests can show the presence of the parasite, and still they can help tailor treatment by determining are these things that I'm going to tell you about through the blood tests. I'm talking about the blood tests. These can help to show the presence of the parasite, and uh, the treatment can be determined, or it can be tailored, or we can get the right treatment with the help of those blood tests, because the determination of this. What is determined? We can determine whether you have malaria. You get that? We can determine, uh, of course, after the blood test, we can determine whether you have malaria, and it can be determined which type of malaria parasite is causing your symptoms. Because we want to be sure we're handling the right type. What well, as in, we want to be sure which parasite, which which species, or which malaria, which type of malaria exactly, you know, and which type of malaria parasite is causing your symptoms, and also if your infection is caused by a parasite that is actually resistant to certain drugs. That we can get to know that. Those are some of the things we can determine after the test, the blood test. That's why the blood test is very important. If you've been to hospital, you should have noticed something like the malaria slide. So that is very important. The blood test is done, and the medical personnel will get to know what to be done next. You get it? And there is also treatment can, you see, the blood test also will help tailor the treatment, because there is of determining if your infection is caused by a parasite resistant to certain drugs. So it can, we can tell which drug exactly should be given to this patient, and also there is help in determining whether the disease is affecting any of your vital organs. You get it? And the other thing is, uh, there is determining uh, if some blood, you see, some blood tests can take several days to complete, while others can produce results in less than 15 minutes. That is another thing to note. So uh, yes, I was talking about the blood test, so it's very, very much important. I don't want to take so long there, but basically, we do a blood test, and um, we get to know what to do. So, yeah, I want to get a little quick. I'm just about to finish, but let's get to the treatments and medications. Of course, we will consider supportive care, but besides supportive care, the of course, the medical team needs to decide on the appropriate antibiotics to treat the malaria. Yes, and the choice will always depend on several factors. So, some of the factors that we consider, some of the factors on which the choice of the antibiotics depends are here. So, the specific species of parasite identified. That is one of the factors. The other factor is the severity of symptoms and determination of drug resistance based on the geographic area where the patient traveled. Um, the physicians will administer the medication in pill form or as an IV, I mean intravenous antibiotic, depending on those factors that I've just told you up there. I I think I should repeat those factors. The factors are the specific species of the parasite identified, the severity of symptoms, and the determination of drug resistance. Of course, based on the geographic area where the patient has traveled. Okay, now what are the most commonly used medications here? I'll just give a mention of these medications, and we have medications like chloroquine, we have doxycycline, uh, we have quinine, there is mefloquine, there is atovaquone, proguanil, and there is a temethylmephantrine. Yes, commonly people call it coartem. Yes, we have primaquine phosphate, and yes, the those are basically the medications used, the antibiotics that can be used. Soon I'll be mentioning I'll be very much more specific next time, telling you that these are, you see, the first line drugs, the second line drugs. But in this tutorial, just would love to tell you, just give a mention of what we need to actually know as far as the medications are concerned. But then next time I'll be talking about each drug in particular, and then tell you what exactly we need, and how much, and how, and where, how. You get it? Going into the details. So for now, I will not be going so much into the details, but I hope we are learning together. And so chloroquine, I told you, chloroquine, there are lots of brands. Yes, for chloroquine, I can recommend, there's a brand called Aralane. For doxycycline, there are brands like Vibromycin, Oracia, there's Adoxa, Atridox. Those are all brands of doxycycline. For quinine, I could recommend a brand called Qualaquin. Then for mefloquine, there's a brand called Lariam. You get it? For atovaquone proguanil, there's a brand called Malaron. For artemether of course, there's this common brand called the brand name called Coatam. That one, people know it very well. Yeah, primaquine phosphate, I've talked about it. And then, as we are finishing this, I find it important to tell you about. You see, of course, there's some home remedy. There's a way you can try to I could call this home remedies. There are some home remedies for malaria. So you can there are some things you can take, and they really be of help. Something like, for example, grapefruit. Yes, grapefruit contains a substance called quinine, and it is said to neutralize malaria inducing parasites, so it can be of help. You get it? It aids in destroying the parasites and strengthens the immune system. A malaria patient should consume grapefruit, and grapefruit juice can combat the disease. You get it? So as I'm speaking this, I'm giving these home remedies because I consider nutrition is very important. So when you go to that nutritional sector, you need to have to know these home remedies. So take grapefruit, and the other home remedies, cinnamon. Cinnamon has a great medicinal values, and it contains uh, cinnamaldehyde. That cinnamaldehyde provides aid, or it does help against inflammation. This spice is full of anti-parasitic qualities. So its consumption provides immediate relief to body ache that is usually attached to malaria. It can be boiled with water. I'm talking about cinnamon. It can be boiled with water, and the concoction can be taken with honey. You get it? It also still about cinnamon. It also reverses the loss of appetite. Yes, it reverses the loss of appetite, cramps, nausea, and so many other things. So consuming this concoction can be a very useful home remedy to fight malaria. You get it? Yeah, and very many other home remedies, and uh, you can consider holy basil, you can consider fever nuts, you can consider ginger, of course. Yeah, let me talk about ginger. For ginger, yeah, ginger is very important. Possible qualities of ginger: help in relieving nausea, they help in relieving fever, they help in ginger, they help in relieving body ache and in improving the appetite. So something important to note is that ginger is one food item which is available in every in most households, I should say. It's ginger is normally there, so you need, if it's not there, please get serious. Buy ginger, get ginger at least, or go in your garden and make it a point that plant it if you can, if you have that opportunity. So ginger is very important. mm. And uh, it can be used as a home remedy to fight malaria and its symptoms. It can be, I'm still about ginger, please. Ginger can be boiled with water and it can be consumed to speed up the recovery process. It has this ginger, please let me emphasize ginger. Ginger has natural antibiotic properties. These antibiotic properties can be enhanced if it is taken with ricins. How will I explain ricins? Uh, you see, this is one of the best home remedy one can do to prevent malaria. Please go get ginger now. Okay. Yes, and lastly, let's mention about the prevention, how you can prevent. Yes, we gave the treatment. We spoke about the home remedies, and now I want us to end with the prevention of malaria. How do you prevent malaria? First of all, use mosquito repellents regularly. Okay, these mosquito repellents you can apply them onto your skin, especially to all exposed areas and clothing. Okay, so for your skin, opt for a repellent that contains at least a 10% concentration of DEET. Um, use a camphor as a repellent. You can light camphor in the room with all the doors and windows closed. Leave it for about 15 to 20 minutes to keep the mosquitoes away. So yeah, that is about the repellents. You see the repellents, and I hope you get it very well. So the other way to prevent malaria is you can use the lemon and clove technique. So here, um, about the lemon and clove technique, just stick some cloves in a half sliced lemon and keep it near your bed while you sleep. Okay, that is another way to prevent malaria. Uh, so I finish this. Use a mosquito bed net while sleeping. Don't sleep on a bed where there is no mosquito net. Please get serious. You need your life, and you have a lot of things and dreams to accomplish. So use a mosquito net. That is very important. Wear long sleeved shirts, put on those long pants and socks, those are all protective measures, my dear brother, my sister. Safety first. Your life is very important. Okay. Another prevent way you preventing malaria is wear covered shoes when outside. You're outside and you're not sure of the environment. Why put on those open shoes? Put on those covered shoes so you are safe. You are sure that you're safe. And then also avoid exercising out, avoid doing those exercises, the physical exercises outdoors, as mosquitoes can get attracted to sweat. So you can choose to do the exercises indoor. That can be also a preventive measure against the malaria. I remember, like I've just told you, that the mosquitoes can get attracted to sweat. To sweat, and then the other preventive measure of malaria is you can empty and clean all containers that hold water. Okay, for example, people have flower pots, they have flower vases, their places, and their animal dishes around home. Yeah, at least once a week, do the needful to prevent mosquitoes from breeding at your house. Okay, yeah, and you can keep your surroundings clean, ensuring that there is no stagnant water. Please try as much as possible, try your level best to do away with all stagnant water. Stagnant water is a breeding ground for the mosquitoes. That one, you have to be sure. Once you have stagnant water, that is a breeding ground for the mosquitoes. My dear brother, my dear sister, my dear client, my friend, my neighbor, uh, my student, my dear friend, my colleague, try to stay in air conditioned or well screened housing. You got that? Let me repeat it. Try to stay in air conditioned housing or that housing which is well screened. Yeah, thank you so much for your time. I will want to stop this lecture here, and I hope you have been blessed. Yeah, the tutorial, hopefully it's been helpful, and we shall get to learn more. Just keep in touch, keep following. Don't forget to subscribe to the YouTube channel. You can ask your questions here, you can drop your comments. Please like, subscribe, comment, like, hit the bell, and you will continue to learn more and more and more with time. Good time. Thank you for your time.